Welcome to the 2011 Arizona Homeopathic and Integrative Medical Association Conference. We, doctors in this exciting organization, believe that we can help solve the healthcare crisis. There's no single answer, however, and in an effort to broaden your comprehension of what integrative doctors are doing today, I have chosen to use an acronym, FIGHT, Food, Infection, Genetics, Heavy Metals, Hormone, Toxins. Obviously that's not all encompassing because the food could also stand for focus, positive thinking, the power of our minds in getting well. So bottom line, the big picture is we have a problem. The problem is we are all toxic. The air we breathe, the water we drink and bathe in, we're being polluted. No place on the planet is untouched. No one is unaffected. Now, this winds up then with something you can relate to. When you breathe air, you're getting particulates. And when we burn coal to give us electricity, as far away as China, that coal burning gives us little particulate matters that goes into our bodies when we live in San Francisco, and we've been able to prove that birds on remote mountains in America have a huge burden of mercury that probably came from the coal burned in China. So this is a little depressing, but we have the pollutants in the tap water, and now we're getting to the point that the latest report on bottled water shows that many of the companies, over 40%, did not admit to anything that they've done to clean the water. They have just taken tap water and then put it in bottles, and they're selling that, and we're getting the additional load of phthalates and bisphenol A from the bottling of water. So many times we might as well have been drinking tap water. But what do you know about the food that we're feeding America? What do we really know about the food industry? If you watch this film, Food Inc., you will change your dietary patterns, I assure you. And you will learn to know an organic farmer personally, by first name preferably, so that you can begin to rely on somebody who keeps you, your loved ones, and your patients with real food. Because much of what we're feeding America today is not real food. And that sets the stage then for nutritional deficiencies to compound the toxicities. So it's not very hard to convince you that we're all toxic, but in case you're not entirely convinced, my website, gordonresearch.com, I have saved the CNN special called Toxic America. This special was 2 one-hour presentations. Sanjay Gupta, a neurosurgeon, was passionate to get CNN to show these. They're not going to play them again, because if they do, they'll soon have no advertisers. Because when you tell the truth, we are in trouble every direction that we turn, including the clothes you wear and the level of toxins that's in the clothes wear. So it was very important to know that this is just a city, Mossville, where everybody is getting a large amount of cancer, and of course even the government is doing nothing. And the company says their vinyl chloride stops right at this. They claim that there's no vinyl chloride. If you live here, it's that their vinyl chloride is trapped the minute you get to the fence. Obviously, that's nonsense. And so when you watch these 2 one-hour specials, you'll begin to understand that no matter where you live in the world, you've got benzene, dioxins, lead, mercury, and they are the real contributors in the background behind the epidemic of health problems we see today in America. But there's no money in that kind of medicine, because it's much, much better to just write a prescription and give everybody something for their anxiety or their depression or their infection. And across the board, we have now so many people that are sick that until you watch this special, and all you need to do is put in 10 Americans on any internet, Google, and you will immediately find what we saw. The Environmental Working Group paid the money to take at random one morning a couple years ago 10 babies, and instead of throwing the placenta and all the cord blood away, they took the cord blood and they sent that in tubes to leading research laboratories along with a check for $15,000 per baby. Now you can get really good testing for $5,000. At Mount Sinai School of Medicine you can get $230, and that will come up again as we talk. But if we now know then that every one of these babies was loaded with neurotoxins, carcinogens, and endocrine disruptors, then it wouldn't come as a surprise to you that their parents, the mother, has the same problem. So that's a new report, brand new in 2011. There are multiple chemicals, including many that have been banned, in every pregnant woman, and this is from environmental health perspectives. These are PCBs, these are dioxins. These are assuring us of children who will either have cancer or developmental disorders. In fact, 1 out of 4 children today going to school in America has to be given a drug for their diabetes, or their brain tumor, or their autism, or their obsessive compulsive, or their sensory perception disorder. Have you ever heard of that? That means the child can't walk on sand because the child is intolerant to feel. They can't have their hair combed. Now, do you think that really is a need for a brand new drug? Of course, Big Pharma will see it that way. Any symptom today that your child or you have, we'll have a diagnostic thing so we can get billing your insurance, and I can have a 7-minute visit and give you the latest magic to treat the symptoms and ignore the causes of your health problems. So these pregnant women are all loaded with these, and what the doctors in OBGYN honestly don't seem to understand, the baby is rapidly growing tissue, and so the rapidly growing cells take up the toxins faster. That's why your cancer in your body is always loaded with lead and mercury and dioxin and PCBs, because they are taking up all the bad stuff. So you get confused, which is the chicken and the egg. Did the cancer form because you were toxic? Or is the toxin being taken up because the cancer cells are growing rapidly? We will always have the chicken and the egg fight. But let's get it simple. You need to learn that if you're going to have your daughter or your wife or your patient go through pregnancy and you're going to do nothing about detoxing them, then you get to pay for the problem child that you're going to have, because a typical autistic kid is costing families in excess of $500,000 and breaking up families. So if you don't learn what I'm talking about, you will pay for it somewhere along the way in somebody you love, part of your family, and there are no easy answers to everything that I will be teaching you today. But I want to have you get it very clear that even a pregnant woman today can have a metal hip prosthesis, and that chromium is going actually into the body and is going to show up in the fetus. So what do we learn? Environmental Working Group are just people like you and I who decided to write out checks so we could get to the truth, because nobody in medicine is playing the truth. They are all nothing but patent drug pushers. Make that sound very clear, patent drug. Because everybody in Big Pharma knows that unless they can get a patent on it, they don't care if you have proof that vitamin C really treats cancer better than what they have, or curcumin is a better answer than any of their drugs. They don't care, because they can't patent it. So they are nothing but drug pushers. Yet that is what is bringing our country to the brink of bankruptcy. The high cost of healthcare is so well understood today that Andrew Weil has got a new book out. It says, "You Can't Afford to Get Sick." And this book explains everything that I will be covering in this lecture, what is wrong with our healthcare system, and what is the chance that with greed driving everything, that we can actually get back to truth and wind up dealing with these problems. Autism, one is actually in 120 children today. Huge increase in brain cancer. Huge increase in leukemia. Leukemia is toxicity, everybody. It's toxicity. So we have got to realize that the old-fashioned way of making babies doesn't work anymore. We have fertility specialists on every corner giving you drugs to force the body to go ahead and carry a pregnancy, because the body knows if that baby that's forming inside that prospective mother is toxic, the body normally lets it miscarry. But no, we're going to overcome the system. We're going to overcome Mother Nature. So we're going to ignore the things. So we have all of these problems happening, and to add to the confusion, all of us have chosen to be on this planet at this time, and the planet is going through what we will call earth changes. Now this has not been factored into your thinking yet, because you're thinking maybe about the possibility of warming. But what about another thing? We now have NASA saying the earth changes. It's possible that the compass one of these days may point south. What does that mean? That means the collapse of the Earth's magnetic field, which guards the planet and guides our creatures so that the birds can find their nesting site, has started to drop like a stone, and the field strength has waned 15%, and the deterioration is accelerating. What does that really mean to you? I will get into that later in one of the workshop lectures with information that will be extremely exciting to you. Because when I bring your magnetic field back up to its full potential, everything homeopathic and natural-wise, nutrition-wise, exercise, positive thinking, all works better, because if you want to see a dead planet, just check out Mars. And when there's no magnetic field, there is no ability to sustain metabolism. We have proven that. We can put you in a room called an ohm cage, in which we take away the Earth's electromagnetic field, and within an hour you can't raise your arm up off the floor, sounding like the tired Americans we have. Now if you're in Japan in a department store and you're tired, they let you breathe free of charge at their oxygen bars so that you can go on and shop till you drop. But oxygen deprivation, because the cars are clearly, challenging us in using the oxygen before we get it. So if you take away oxygen enough, and then you don't have the magnetic field, now this is a factor that you haven't plugged in. And when I bring it to your consciousness later in the talk, we're going to have you bring the physics back into physician, and you're going to understand laser and electricity and the distance between Tesla electricity and what you can do with static magnets and what you can do with pulse magnets. So bottom line, allopathic medicine is just not the answer. If you really want to understand how bad things have gotten, really listen to the best that allopathic medicine can offer. We have a radio program, it's called Dr. Radio. Just type those words in and they'll immediately come up. NYU Medical Center has a program that plays all day, every day. And it is from the NYU Langone Medical Center, and they answer questions from you, the public, on any topic, from psychiatry to sexual disorders to pediatrics, orthopedics. There's no area that is not covered with a head of a department answering a question. Now that's on Sirius Satellite 114 or XM 119, and if you don't have that, you simply listen to it on your computer. But the point is, if you would give me the funding, I would take all of the answers they provide you when you call in with your child that can't learn, or your cancer that won't go away and it keeps coming back, or your bone that won't heal, or your pain that won't go away, and I will give you the answers that those of us who practice integrative, alternative, homeopathic, advanced medicine would be wanting you to learn, because you're not getting the correct answers from mainstream medicine, because we're under this uneven playing field where that's third-party covered. And as long as they give you a label and hang a label that you're schizophrenic or psychotic or some kind of label on you, they can get paid. Of course, they've wrecked your life and they've done nothing to determine why you have those mental aberrations, those learning disorders, why your children aren't developing normally. They just have a drug for it. So if we understand that it's not the answer, you need to know that more and more people are questioning how bad things have gotten. And you actually have got JAMA with an article saying things that for the first time people are learning that about 100,000 die each year as a direct result of an error. Well, that's just the tip of the iceberg. There isn't a doctor practicing at leading medical centers in this country whoever bothers to measure the lead or mercury in the person that is being treated. And I don't care if it's heart disease, cancer, or learning disorder, or depression. They never are looking for causes. Well, one of the factors could be cost and lack of knowledge. It turns out to actually measure the toxins in your body so that you know how much polybrominated diphenyl ether is in you, as well as dioxin, PCBs, etc. You have to send a check to Mount Sinai School of Medicine for $5,000 and 20 tubes of blood. But all of a sudden you'd be practicing real medicine, wouldn't you? Because we can't ignore the fact that these medical mistakes are killing over 100,000 people a year. These are the deaths, 80,000 people dying of infections. You know, just you see the word infections in hospital, and if I can just get everybody to learn a little bit about silver, I can absolutely show you that 90% of these infections are not resistant to silver. And you can take somebody who's supposed to die in the morning of an antibiotic-resistant infection and let them drink a bottle of a well-formulated colloidal silver formula, and they will be alive in the morning, whether it's an animal or a human. So cancer drugs, what's going on? We're bankrupting everybody out of this simple nonsense. If you learn what's going on, these drugs that they give you when you have a diagnosis of cancer can cost you $100,000 a year, or even $300,000 to $800,000 a year. And what are the drugs doing? They're suckering you. It's called a sucker punch. You go ahead and stay with the idiot oncologist who tells you whatever you do, don't ever take any vitamin C. Don't change your diet. Diet has nothing to do with cancer. Well, he sucks you dry for the little amount of $93,000, and you're going to live 16 weeks longer, average, 16 weeks. Now, why am I so mad? Because those 16 weeks are worthless to you, because for that whole time he treated you, you felt so lousy, life wasn't worth living. Losing hair and being sick and vomiting your socks up every day is not a good way to live. But what I'm really mad about is because it's such an uneven playing field, they have the big white tower, so you are sucked into going there, and because your insurance pays 80% of it, you forget you're still going to owe $20,000, $30,000 out of your own pocket, so you'll still go bankrupt. But at least it's mainstream medicine. So you don't think for yourself and get outside of the system and learn what I will cover in the workshop today about alternatives that are really making people live at least 2, 3, 4, 5, 6 times longer than the incompetent drugs they're giving you. So the desperate measures, when a drug is given fast track approved, so they've got Avastin. When you read up on Avastin, you're going to see that everyone's now turning against it. It never did anything for anyone, but they're getting $88,000 a year. So a lot of doctors really don't care very much as long as the money goes in their pocket, and the oncologist keeps the money on these deals. They mark it up, they put it in your vein, and the money goes in their pocket. And they tell you at the same time, whatever you do, don't take any vitamin C, which is such corrupt, incompetent nonsense that they should be disciplined for medical incompetence. So now we have the other side of the coin. If we don't either burn you with radiation or cut it out or give you chemo, they have nothing else they can do for you. They don't even wish to bother to give you real good psychological support so you get your life in order and lower the level of stress and start understanding how important exercise and diet is. They don't even want to bother with that. There's no money. They can't get you in and out with a 7-minute visit if we talk diet or exercise or lifestyle. So now we have a great approach. Now doctors can get paid for taking out perfectly healthy tissue. We can take off both your breasts and remove your ovaries. Isn't it wonderful? We get paid for it, and there was nothing wrong with those tissues. You simply sucked into a system that's lying to you. BRCA1 and BRCA2 are not an open and shut warranted case to cut your tissues out of your body, because you will never have your full normal lifespan if you take out your ovaries, and you're not going to have your full enjoyment of life if you go through this nonsense. But what I can tell you is in our later lecture in the workshop, we'll explain to you how we have 10,000 patients who have survived 10 years, and not one of these patients died of cancer. 10,000 of them. All we did is a blood test each year to warn them if their cancer burden was getting a little heavy, and you'll understand how it's possible with lifestyle changes, nutritional support, immune support, and detoxification, including using a far-infrared sauna, that you would not need ever to go through this nonsense of cutting tissues off, because genes don't express themselves to give you the cancer if you do all the things that we can teach you. And then do once a year a cancer screening test to be sure that you are doing enough. So, this is the nonsense that's going on. Mastectomy and removing things is going on because your mom had cancer, they had you get the BRCA test, you said, oh my God, I've got the same gene mom has got. Well, of course, but mom was smoking, and mom was drinking, and mom was never exercising, and mom didn't get rid of the junk food, so you're getting sucked in. So now the story the plot thickens. Now it turns out that this is front page news that it appears 90,000 women have been operated on for so-called intraductal carcinoma in situ, DCIS, and they didn't even have any cancer at all. In fact, DCIS is the biggest racket going because it isn't actually cancer, it's pre-cancer. But the minute they put the word cancer in, you'll buy anything they're selling. You'll have your breasts removed, you'll take radiation, you'll do all their nonsense. And I will show you that their radiation isn't helping. And it can all be handled in other ways. So it's very important to know that there's so much surgery, radiation, and drugs, and fear. They're operation. So this whole thing, ductal carcinoma in situ, is really a pre-cancer. But by putting the word cancer in there, they have you sucked in, and you are willing to do whatever you can possibly do, and having everything cut off is not the answer. Why do I say that? Cancer is a systemic disease. And as a systemic disease, it means that cutting this off isn't going to do anything, because you really need to cut everything off, because it means it's throughout my whole system. And you will see that Johnson & Johnson has a blood test now that finds the cancer in your bloodstream, even though your expert urologist tells you, no, it's just in your prostate. 67% of the time, the new Johnson & Johnson test being done at Mass General and Sloan Kettering proves that the cancer is already in your bloodstream, which means they're lying to you. And now you're going to be empowered so you can fire the doctor that keeps sucking you in with these outmoded treatments like Avastin, because it says very simple, the new test is collecting how many cancer cells are in your blood. And if you keep going to the stupid doctor and he fries you and your hair falls out and you're vomiting every day and it's going up, you might fire him and go to something that makes sense. There's lots of things that make sense. So, does radiation add to survival? They're very embarrassed to have to admit, the authors have admitted, that the addition of radiation does not impact survival in distant disease, breast cancer especially. Anyhow, this is the proof then that if you would learn how to use tamoxifen, now tamoxifen is merely a synthetic form of estrogen. Fortunately, I travel the world and I go to meetings all the time and I share all this information with 3,000 health professionals in my School of Advanced Medicine called FACT, which any health professional is free to join. And you can go there and you can put in the word tamoxifen after we give you a password, because this has to be membership only. Otherwise, FDA and FTC hassles us for sharing information. But once you're a member, then FTC, FDA cannot restrict the free flow of information between health professionals. I just can't put this on the open internet for the public to learn all these things. So tamoxifen happens to be very interesting, because if you read what this is saying, it's saying that this synthetic estrogen alone was better than taking radiation. Or even with the radiation, you still did better if you didn't take the radiation. So this gets complicated. But I have a natural product from northern Thailand, which we call Pararia mirifica purestrol, which happens to be actually available worldwide. Longevity Plus calls it HRT, but the point is that you've got a natural product that does everything tamoxifen does without any of the side effects. So that's exciting. So radiation is not going to be the answer. So these guys are going to, their day is coming. You're going to wake up the public one day, because the power of having Johnson & Johnson approve a test, because I've been doing cancer screening tests on my patients for over 20 years now. But without the power of Johnson & Johnson and Sloan Kettering and Mass General getting involved in a test, no one pays any attention to my 10,000 patients in Tokyo, working with Dr. Kobayashi, an MD, PhD, molecular biologist, pathologist, oncologist. So he's really knowledgeable. And Sun Moon Church paid the money so everybody would get a $500 blood test each year so we could be sure how much cancer was in you and whether you were changing your lifestyle and diet and stress levels enough to bring your cancer levels back to safe ranges. Because we all have cancer all the time, but all we want to do is keep it safe. So who needs to detox? Well, toxicity is still the primary issue we're fighting. Whether you're talking diabetes, cancer, obesity, asthma, ADD, ADHD, autism, arthritis, there isn't a condition that should not be detoxed. But here we have a lot of flim-flam. And a lot of people ride on the work of the doctors in chelation therapy. As the co-founder of ACAM some 38 years ago, I wrote the protocol that has actually chelated some 10 million patients now safely without a single known fatality as a result of my treatment. So if you think EDTA is quackery, then try to understand, if EDTA chelation therapy is so bad, why did I get 29 million from NIH for the trial to assess chelation therapy, which is an ongoing multi-center study going on right now? Why did I keep working that hard when everybody wanted to lock me up in jail and throw away the key when I formed ACAM 38 years ago? Because they said, lead has nothing to do with heart disease. In the workshop, we will give you the solid documentation presented by Dr. Mark Houston, head of Vanderbilt Department of Hypertension Research, and the exact reasons that the lead and mercury and cadmium are things you should be treating. But since it's all been marginal medicine, it's all been marginalized and ignored the fact that we don't amputate legs, I can teach you all the tricks, and I haven't had a patient die of a fatal heart attack now in over 30 years, and I cancel bypass, I cancel stents on every patient, and I have patients come that are supposedly 90% blocked in their artery, but they don't need surgery. Because the benefit-risk ratio is that my patients aren't dying when I simply give them what I call beyond chelation, which is a pretty big word. Chelation, you don't understand, is from the Greek word claw, and chel is actually the claw of the amino acid material is grabbing the lead mercury and make it now so they can be escorted out of the body. To go beyond chelation, I had to actually make that product able to actually work in your body like heparin so you don't die of a clot. It gets a little confusing, but we'll get that later. But it's important to understand that I'm standing in front of you because at age 29, I had to close my medical practice. I was so sick from the time I was born. My fevers would run 104, 105 out of the clear blue sky. My teeth all came out of my mouth. I had to have all my mercury was in every tooth in my body. I was so sick I could never participate in any sports. I was never allowed to. I have a heart lesion, and the list goes on. I had total achlorhydride with the lowest level of magnesium ever tested on anybody. I became the director of a laboratory with offices in Tokyo, as well as Amsterdam, San Francisco, and Boston. So I'm an authority on trace elements because it was the only way for me to get my health back was to figure out what happened. And so to me, everybody who's ill is merely a detective story waiting to be solved. And if you choose to become a Sherlock Holmes, you may tease out the whole thing. What was the whole contributing thing that, why would Gary Gordon be so sick? What was in my mom? What was in my father? My father was a 10-figured osteopathic physician who brought me back from stuttering and cross-eyed and totally unable to do anything and got into cranial therapy. And he spent hours trying to mold my body back into something. But I would go around with my head stuck on my shoulder for a year and a half at a time, and nobody could treat me because why? Every time they would give me manipulation, I would get worse because I had no stomach acid, so I didn't absorb any minerals, and I had every tooth was filled with mercury. So I had the highest levels of mercury on the hair testing and the lowest levels of magnesium. So it would make sense that nobody could cure me. But if you didn't know about the Heidelberg pH test and how to measure the stomach acid, because we have these children who are being diagnosed as GERD, G-E-R-D, and they're giving them a proton pump inhibitor so they have no acid. If they have no acid, do you know that there's a 44% increase in broken bones, fractured hips, etc., osteoporosis when you keep people on the stupid drugs that take away the ability of the body to work properly? So the medicine has it all wrong. Virtually whatever they do, I will do about the opposite. But that's because I really know my business. I go to every meeting around the world. I've spent millions setting in conferences. For me at age 76 to stand in front of you today and feel as good as I feel is because I have learned in great detail every one of the fields of healing. I do lots of massages. I do lots of exercise. I do the diet. I do it all. But I also know which homeopathics are going to help me, and I know which nutrients are going to help me, and what the truth is on detox. You see, as somewhat considered by some to be the father of chelation, and having wrote the protocol that was safely treating 10 million, it's so sad to tell you that IV chelation doesn't take the lead out of your bone. And I've explained to you today that the children are born extremely toxic. I didn't tell you how toxic. Later in the workshop you will learn that we actually have an average 20 years ago, average, was 1,000 times more lead in the bone of every person on the planet when they're born. And it gets worse the longer you live, than any bones from just 400 years ago. Now that's Caltech, that's Claire Patterson. He's the guy that went to the Arctic and the Antarctic and drilled down and got the ice cap and measured when lead was released into the environment. He's an authority on it. I had him speak twice as program chairman of ACAM. My job was to try to train the some 1,500 doctors who belong to the American College for Advancement of Medicine in a little piece of what I know. But I belong to the American Academy of Environmental Medicine, and I belong to the Institute for Functional Medicine, and I belong to all the institutes for integrative medicine, and I belong to the holistic medicine, because I know that no one seems to have the whole story. So I have to be very eclectic in my approach. I need to learn it all. Which are the herbs? What are the traditional Chinese medicines that are letting me sleep today better than I've ever slept before? So that we have meaningful delta sleep to restore my body at 76. At age 76, I need everything going the right way because I have a lot of duties to do every day. But these conditions are absolutely not going to go away unless you learn the problem. The lead in the bone doesn't go away even with IV chelation. If you had all the money in the world and you in perfect veins and you came to my office twice a week, and I've had over 200 IV chelation. I've had over 100 oxidative therapies. Oxidative, what's that? That's using things like hydrogen peroxide. That's using things like my hyperbaric chamber. I had the $100,000 chambers in my office. That's using things like ozone, ultraviolet light irradiation, because I want free radicals. You can't go through life putting out free radicals because they're the only thing that allow a white cell to destroy a cancer or an infection. They have to release something like hydrogen peroxide to kill things. So there's a little bit of problem on getting balance. But the big problem that makes me mad is that we can't get that lead out of your bone with any agent that I have unless I get you on a program, because bones take 15 years to remodel, and during that time, if I don't have you each day taking something, whether it's zeolite or fiber or high doses of C or oral EDTA or whatever I can get you to believe in, I take a green drink every day of my life wherever I go. It's got in it organic greens, it's got in it an advanced fiber, I have in it maca, and I have in it EDTA that has got methylation support, and a vitamin C that actually goes as a delivery system and allows me to live on never less than 10,000 milligrams of C every day. Linus Pauling was my friend. I was so intolerant with my bad stomach that I could never take more than a gram of any C without living in the bathroom with diarrhea and gas. So I had to develop a C that would work for anybody and provably maintain high levels of C in your urine, which you'll see later in other slides. But I'm getting to the point then to tell you that now we have, in later workshop slides, proof right out of Harvard Medical School that they can tell you how much lead is in this bone or that bone. And this simple approach allows them to publish papers saying that the level of lead in your bone determines how soon you go blind with a cataract. That's published in JAMA, but no one reads it because they can't make sense out of it. After all, chelation has got to be some kind of quackery. I mean, we wouldn't legitimately. So the average doctor, even though it's a law in California that you should not put a child on Ritalin without measuring blood lead, nobody does it. Why? Because if they measure the blood lead, they'd have to say, well, what's safe? How much lead can you have? Or how much mercury? And then all of a sudden they'd have to say, this child's a little high. How are they going to duck it? Then if it's a little high, they're going to treat it? Are they going to become a chelating doctor? Everybody knows that's marginal medicine, and it's not covered by insurance. So obviously, let's just give the kid Ritalin and ignore what caused the kid not to think well in the schoolroom. So if we understand that if you take something each day, like my power drink twice a day, and oral chelation that I take every day, I don't go anywhere without some oral chelation. And bottom line, we spent about $10 million figuring this out. But what it does is it means that each day, no matter what I eat, and so I have to travel a lot, so I eat where I am. And I know the food is poisoning me. But as long as I have it well thought out, then I'm going to be with my high dose of C and my fiber and my maca and the EDTA and the greens, I'm pushing more out than gets into my bone and brain each day. I have a pretty good chance at age 100 to be just feeling as good as I do today because I've learned how to use pulse magnetic therapy and a static magnet pad in my mattress so that I'm always getting 20 Gauss because the earth is now down to 0.3 Gauss. And that's not allowing you and I to function optimally. So the need for detoxification is in every man, woman, and child. But don't believe these people who say they have figured out a way and they can get you totally detoxed in a matter of 3 days at a big weekend treatment. It doesn't work. So as we get into this picture, fighting for your health is what I'm teaching you, whether it's biological or energy therapies, which is the future. Energy thing is where you'll get into the physics behind being a physician, and you'll learn to go back and study quantum mechanics. And you'll begin to understand that a laser can actually, in a magnetic field, do things that it could never otherwise do, and you'll do as I do. I take a hot tooth, and I cancel any need for seeing the dentist or a hot ear. I take a little magnet, and I hold the magnet here, and I take the laser pointer, and I put some laser on that tooth while I put a magnetic field north-south, and all of a sudden the tooth in less than 10 minutes is pain-free and you don't need it jerked. Because you're giving the body the photons, which when you study quantum mechanics can become electrons, and electron deficiency is what we're treating when I give you 10 grams of vitamin C. So there's a rationale to everything I'm doing, but it goes beyond anything that you're learning in any of the single schools of medicine today. Mind-body intervention, manipulation, I believe in every one of the approaches. We need it all. We need osteopathic, we need manipulation, we need yoga, spirituality, homeopathy, natural, Ayurvedic, all of these. But we also need the magnets, and we also need to know how to use the body. There is no easy answer to feeling good at age 76 when at age 29 I could not walk up a flight of stairs, had to close my practice because I had to sit in a chair while the patients were brought to me. I could not go from treatment room to treatment room at age 29. My heart had completely given out. So my fight program is my effort to put all this information into something that you can utilize to help protect patients who are doctor shopping because they're not getting the help they need from any one of us. And if you get this into the patient's mind, they'll understand that if they saw an infectious disease specialist, everyone would have some XMRV or some Candida or cytomegalic virus or one of the other herpes families. Everybody has some of these infections, but nobody's treating them because they're not easily to treat unless you learn which are the effective, safe silvers that you could take every day to cut down the total body burden of all these pathogens. So on this slide, you can see it's food, infection, genetics, heavy metal, hormone, toxins. Now, it's hard for you to become knowledgeable in every one of these fields. I go to the meetings of various groups, so I understand bioidentical hormone replacement, and I understand the toxins, and I understand the need for a far-infrared sauna in virtually everybody's life. And I understand the need for something to dramatically lower your total body burden of pathogens because in China we have 100 million people today that are walking around with a hepatitis C or B infection, which over time will lead into liver cancer and other unhealthy situations. That's on top of the AIDS, and that's on top of the TB epidemic, and that's on top of the new AIDS, which is the XMRV that I'll get into in later slides. So in an effort to try to get you comfortable with genetics. I just take a simple example when we get into it. I try to point out to you that whenever you drink out of that bottle of hardened plastic, you're not getting just the phthalates, which are 10,000 times higher in every man, woman, and child today than they were 10 years ago, which is leading to this huge dropping of sperm so that we have harder and harder, more and more difficulty having natural pregnancies without the help of a fertility specialist. But if I get this bisphenol A in your head, you will understand in this later slides that I will be showing you how we can wind up with the bisphenol A causing a change in your genes overnight that brings on obesity and diabetes. You heard it right. Right out of those bottles. We documented all this, as you will see in later slides. Now, of course, food. If we have a huge war going, oh my goodness, should we be on a Pritikin? Should we be on an Atkins? We have the devotees. And there never seems to be anybody who really puts it all together, but I did see one report that I liked. And that was a report that Interleukin Genetics actually has developed a test to find out who in the population would do better on Atkins and who would do better on all vegetarian diets, because there is a difference genetically, and that helps resolve some of this. And we looked at just weight loss studies. When we did the gene test, there was a dramatic difference in how successful weight loss is when you matched the diet to the patient. Now, Dr. Danziger is doing great work on diet and weight loss at Tufts, and he's one of the doctors teaching at the Institute for Integrative Medicine in a recent meeting, and he was showing that it made no difference which diet you used. His average weight loss over a year was about 6 pounds, and the only thing that made a difference was compliance. How motivated was the patient? So when you didn't change the diet to fit the genetics of the patient, it didn't make much difference. All of his patients had less diabetes. They were healthier when they stayed on the whole program. But I tried to gently point out to him that he hadn't kept up with this development, and he was unaware that there was a test that you could do to help determine what would be best for the patient. So what we're trying to do is use FIGHT as a protocol for health and have you learn, and as you get into food, you can see that this will be a never-ending fight, because everybody has their religious beliefs, the familial beliefs, and to try to break it out. And of course, the thing is that it doesn't make any difference. If you're getting the standard American diet, you are absolutely in trouble. So, with that said, we're going to take a break now, and we'll get into much more depth on the food story. Well, we have 3 hours for our workshop, and the workshop we intend to get into FIGHT in great depth so that you'll really be able to take and work with some of these concepts. Shocking facts you might not realize about your food is that American children get 40% of their calories from junk food, and a huge amount of that until recently has been from high fructose corn syrup. And we can find things like mercury in high fructose corn syrup, and we can also find many other dangers with high fructose corn syrup. So if we look at the picture, Food Matters is a film, can save your life. As Hippocrates said, let the food be thy medicine, and thy medicine be thy food. Fresh, healthy food along with exercise and a healthy emotional outlet is the fountain of life youth we're all looking for. And we have got, in addition to that, less than 6% of graduating medical students in the United States get any formal training in nutrition. That's what's so incredible. Yet when you're sick, you go to the doctor, and you're not getting very useful information. I can't make that point more clear than to say, please join on Sirius Satellite 114 and listen a couple of days to question and answers being answered by a leading medical school in our country, with the professors, the head of departments, don't even amongst themselves agree, because fortunately, there's actually a department of holistic dermatology at that medical school. So now we have, in a medical school, with all the straight thinking that everybody has a deficiency of drugs, and we know exactly what drug to use for your child, we have a doctor who says, everybody that is brought to him with a skin condition on a child, he makes sure he gives them acidophilus. Somebody actually thinking there's a need in acidophilus for everybody. Why? It's because we've been, all of us, ingesting pesticides every day. Pesticides kill what's the normal healthy flora. And the flora in our intestine really determines greatly what your life is going to be like. So it's quite interesting to have one department in a whole medical school actually can spell the word probiotic, even knows that food is important. And what is astonishing is he said he does muscle testing, to see how well you, if you hold some sugar next to you, so he does muscle testing. Nobody else in the whole medical center would do that. So it's going to take a while for these avant-garde, advanced medical concepts to become part of mainstream medicine. But you need to know that you have many foods that are not healthy for us. And the rise of the antibiotic resistant among farm animals is just a tiny piece of the puzzle. In fact, this is where the big part really frightens me. This is the book called Seeds of Deception by Jeffrey Smith, who I've spent many, many hours with. And single-handedly, Jeffrey Smith is trying, like the boy with his finger in the dike, is trying to hold back Monsanto. Because Monsanto has the attitude that they're going to control every seed on the planet. And therefore, no one is allowed to have a seed in the ground that they didn't invent. And their seeds are designed to carry a pesticide. When the seed comes up, the food you're eating gives you Bacillus thuringiensis, which is a pesticide, which seems to tear up the guts of the animals, and many of them die. And yet, nobody can listen because Monsanto is so powerful that they have been able to buy whatever approval they need at the congressional level, and they can't be stopped right now with bribes, threatening. You will not believe how frightening this is, but just know for you, if you can find an organic farmer and know him by first name, you may have a chance of avoiding the sad story of what we call genetic roulette, because these crops are bringing immune reaction. In fact, sensitivity to soy went up 30% in the first year that they introduced genetically modified food in England. And of course, today we have this epidemic of asthma. Now, some people will fight as to whether that epidemic of asthma is more because of genetically modified foods, with the kids all now being sensitive to so many foods that you really don't know what to feed your child anymore, or is it because of the vaccinations? Because there's data on both sides. So it does cause a lot of problem, because if you're the parent, you're the one that's going to pay all the money when your child can't function in school, can't learn, has asthma, has brain tumors, autism. The list goes on, but the diet shows toxic reactions in the digestive tract when you're on a genetically modified diet. And they certainly plan to do this to the salmon, and they want to do it to the tomatoes. They in their mindset, they think the only way we can avoid starvation in the world is we have to modify the genetics of all the food we eat. When we look at genetically modified soy, and we look at the actual change in the testicle, you can see unhealthy testicle, which kind of looks like the American male today that doesn't have enough sperm to be able to impregnate his wife. Almost 40% of young men today may not be able to conceive a child, but we can see the control looks pretty healthy. So if you could get genetically modified food out, that would be a big step. So the health hazards of genetically modified corn are so well documented, and it's mostly corn, soy, cottonseed, and canola, but they're certainly hoping to get to tomatoes, and they do want to get to salmon. They have a lot of things. The judge, fortunately, slowed them down on sugar beets, but they are inexorable, and just unless we become totally informed, we can't win this fight. Now we find that there's a new problem. Arsenic is showing up in the rice. And the food standard that infants not given rice as a replacement follow a new study potential to get too much arsenic. So toddlers consuming rice instead of breast milk, they think that their intake of arsenic could be increased by up to 4-fold. Now, arsenic is just one that we'll get into in my workshop on the heavy metals. The high fructose corn syrup is a problem because we're not designed. First of all, corn, because you're getting it from genetically modified sources, is a poison. Secondly, if you had, we were never designed to have corn be a mainstay because we're not designed to be living entirely on carbohydrates. What's happened is that if you look at the research, Dr. Danziger admitted to me privately in his research that if you looked at cardiovascular risk factors like HDL, you could see better levels of healthy HDL, that's the light, fluffy HDL, in the people who are actually getting animal fat and protein. So in spite of the whole concept that we were never designed to have anything but vegetables, the data doesn't support that. But as I said, these are very, very complicated matters, and everyone's going to vote with on an emotional level, not necessarily are they going to be voting on a basis of facts. So we're going to continue to help to put these facts out to you so that you understand and can make an intelligent choice. But we believe that the high fructose is helping bring about this epidemic of pancreatic cancer. I have friends who virtually one day were healthy and 2 months later are dead with pancreatic cancer. Of course, that's because those friends are afraid to spend their own money and use biological methods to treat their pancreatic cancer. They always vote, because it always seems so safe. You've been told you got a serious cancer, let's go to the White Tower. They're such nice guys, and even if the treatment's $50,000, $100,000, my insurance pays a lot of it. And only when it fails do people then call me. And I've lost a lot of interest in treating people after the fact, because it's not easy to bring you back to life after they've radiated you and burned you and operated on you and chemoed you so there's nothing left to treat. So I really want people to start thinking for themselves and look at the facts when we get to the cancer part of my presentation. But across the line, we are all getting 100 to 120 pounds of sugar hidden in our diet each year. And it's definitely, this glucose is to the point that we now know 40% of us are going to be diabetic, 50, 60% of us are already obese. And it's this refined carbohydrate that's causing a problem. And of course, it's cheap. It's a lot easier to feed your family at McDonald's than it is to go out and buy the fresh fruits and vegetables. It's sad. We have the whole thing topsy-turvy. But glucose is accumulating in the blood, and when you see the new guidelines for what is the safe level of blood sugar, that number has changed and changed and changed. Now, those of us in anti-aging medicine agree that a fasting blood sugar shouldn't be over 85. And when you eat something, it shouldn't go over 125. By that strict definition, 90% of your patients will not meet that criteria. And so if you use this as an intelligent way to help motivate patients into exercising and diet change and the proper use of supplements, you can bring people into these things, because if at age 80, 90, you can still bend down and touch your toes, it's because you haven't got too many cross-linkages, and the cross-linkages are the glucose to the protein. It's part of the same kind of thing that happens with your windshield wipers and your garden hose. You know, your garden hose was flexible when you bought it. Well, that's the kind of change that's going on in you, in your arteries, when you are having elevation levels of sugar, because we all have this little addiction to sugar. Now, the picture to the left is actually from 40 years ago. So this is not a current picture, but was in an old magazine. We thought you'd get a kick out of the fact that they said sugar is the best way to give you the willpower so you stop eating. Now that was cute. That was like the old cigarette ads. We wanted you to enjoy this, because most of you may understand that sugar begets more sugar. And it's very hard. It's like that one potato chip always calls for the whole bag. And so we have to realize that this is not a good thing. Now, mainstream medicine has been always fighting who's got food allergy and who's got food sensitivities. You, as the consumer, really don't care, and you as a doctor trying to get your patient healthy, whether it's mediated through pathways so that it's true allergy versus sensitivity, who cares? If it's something that's bad for it. So I just want to make sure that everybody knows that the ability to test and determine which are the foods that are killing your patient, that's where the payoff. And there's many tests. There's LCAT, and there's SAGE, and there's many different, there's ELISA Act. We have lots of tests, and we have muscle testing. The problem is, which tests will you believe enough to change your diet? And because a $1,000 test may come back and say that you're not sensitive to milk because you'd already stopped eating milk. And so you sit there and say, well, this test is useless. I've already known it. So the problem is that certain tests are only going to show the milk if you consumed it. So the problem is how to get the test to you that will help you as a patient or you as a doctor really get the patient onto a healthier diet. Now, a simple blood test. It turns out you can lower inflammation when you actually get the patient off of the foods that they can't handle. We've seen a huge increase in the market now. Gluten-free foods are mainstream. Thank heavens. But that's the tip of the iceberg. Because whether it's gluten-free or casein-free or getting off the genetically modified foods or finding foods that really put nutrients into your body. Because if it's not in the soil and the farmer is not being paid to put some trace element back on the soil, I think in the long run, the way our world is going, that we'll go back to what, when I was a kid, we had the victory gardens and we actually raised our own food. Remember, I was born in 1935, so I've been through that war. And so I do think we're going to get to the point that one day, many families will cooperatively have family co-ops and we'll be raising our own food if you can't find an organic farm to work with, because food intolerance versus tolerance, what's the difference? Well, the ability to, is tied to so many things. And a food that disagrees with you today, you might be able to eat tomorrow if you hadn't been eating that same food 2 or 3 days in a row. So it gets a little confusing. So we like 4-day food rotation. But when you get into this whole program, Meridian Valley has a test. They have 95 tests that it does not overlap. So they test all of these things. And they are going to do IgG4 and IgE. This is the Elizabeth. So there are many laboratories, and Dr. Wright's a good friend of mine, and he's certainly done a wonderful job as a true medical detective, changing many people's lives, helping them figure out what's really going on. And so people that don't want to spend $1,000, we got to figure out another way. So I liked it years ago, Dr. Bland just put a book out, which I got a kick out of because it told you how you could take everything off the shelf in your house and go to the health food store and what to buy so that you were immediately living entirely on foods that are low probability of you having reaction to. And so he called it a 20-day rejuvenation, because if you stopped eating the foods that we are allergic or addicted to, because there's an element of addiction. In other words, you get to the point that if you really need that next fix of milk, you wake up in the middle of the night and stumble and get another glass of milk because your body is going through withdrawal. And so it's really a nice thing to know that you can buy a book like this on Amazon used for $5 and have some education of what you can do. But Dr. Wild is trying to have people find out what is the way to approach this. The only reliable approach is to use avoidance and provocative testing. In other words, an elimination diet followed by a challenge. Well, now that really makes sense. Now, let's warn you, if you really went on an elimination diet, the environmental medicine group for a while would suggest that you live on a rutabagas for 5, 6, 7 days. And the thing is, that's a pretty neutral food. You get a little tired of it. But as long as it's something you can afford and it's not expensive. See, I've been in the position that when you're stuck, I was in the middle of the ocean on a cruise with a friend, Phil Hanna, and he collapsed on the floor. And we were sitting at the table, and dining table on this cruise. And we checked his blood pressure, and it was 290 over 190. And so we immediately, with me on hypertension, I just immediately take you off whatever foods you were eating, and we were on a cruise eating like pigs. And so I said, this is simple, Phil. He said, well, you don't have your office here, what are you going to do? I said, this is very simple. You're going to live on water. And so we're cutting you off all food. And so in about 3 days, his blood pressure is back to about 140 over 80. So he says, okay, wise guy, you proved to me that if I don't eat all this food I've been scarfing down on this cruise, that I can live. But please tell me, how am I going to stay alive? What are the foods I'm allowed to eat? So, very simple answer. If it's a food you haven't eaten in 6 months, the chance that you're allergic to it is extremely small. And so I don't care if you did get rutabagas or triticale or amaranth or kiwa. I don't care what the name of the food. It could have been watermelon. The point is that any food, but I can't just let you become a pig and start eating that food because of these underlying conditions where we don't all take a probiotic each day and we don't take the fiber, which I have to have a little more fiber now, because the fiber is what feeds my acidophilus. So it's an interplay that you have to understand. The fiber in there is really quite an amazing food. It's stabilized rice bran. We've thrown away rice bran for years. Everybody just wants white rice, throw away all the good. But we finally found a way to take that rice bran and save the octocosanol and the gamma oryzanol and the beta-cytosterol that it's loaded with, which is a major answer to your body, almost working like cholestyramine to carry toxins out of your body. So it's no accident that I grab for my green drink constantly, because it turns out that when you understand this, I don't care which doctor you go to, and I have many colleagues in all these associations, whether it's holistic, environmental, the American College of Advanced Medicine, none of them seem to pay full attention to the fact that the toxins are going to be delivered from your liver into your gut. And the gut has got to have something there to catch the toxin, or it goes down 2 feet and it's reabsorbed like food, and the mercury from your right eye winds up in your left eye, and you've wasted a lot of time and money and lost an opportunity to feel as good as I feel at age 76. That's my passion. I would like to think that at age 76 I've learned something, and maybe I can be of some value to my fellow citizens because of the millions of dollars I've spent in restoring my own health. But in order to have you put all that in perspective, you need to understand that there is no single answer alone that will allow you to feel this good at age 76. That's why I keep going to meetings at least twice a month somewhere in the world, and I sit in the front row, whether it's on stem cell research or whether it's going to be on prayer. I am open because I want to feel good, and I'm only trying to help short-circuit you so you don't go down dead pathways and show you pathways that have worked for me. But I want to make this point extremely clear. The diet is still a major piece of it. And so, with my friend with the sudden collapse with hypertension, no one teaches this idea that the food could cause hypertension. They just give you a drug. Nobody even mentions it. Yet, there's a book by a head at the Columbia University School of Medicine, Dr. Arthur Coco, and if you buy his book, The Pulse Test, it'll cost you $7 on Amazon. It's a big investment. But it may save you millions of dollars of being sick, because he tells you if your pulse goes up more than 10% after you eat a food, it suggests your body didn't like that food. So these are some simple ways. So obviously if your pulse went up, your blood pressure might have gone up, but nobody wrote the book yet about blood pressure and food, so you've never heard this before. But what I'm trying to do is tell you that the trick here is if I take you completely off of food for a period of time and then I reintroduce that food just by itself, single food, and you're really allergic to it, you could go into a real attack of your asthma or disabling migraine. You could really get hit. So I need to warn you, but this is part of the task, because you came into this world naked and screaming and toxic, but you didn't have the owner's manual. And for that reason, you're still not figuring out, how do you maintain this body so that it can last you 76 years of age and still feel good. So this is a great story. Patrick Carlisle is actually a practicing doctor in England, and it's a pseudonym because he didn't want to have a fight with the medical society as they have done to Dr. Wakefield, a story we'll get into later. So this doctor is one of the top doctors treating MS. And he wrote a book by sometimes anecdotal stories are the only way you can really learn. So if you get this medical detective, he's telling you this book is all about people who've been sick their entire life and had every kind of symptom, whether it was psychiatric or disabling arthritis. I don't care what symptom you want to talk about. It didn't get solved until he did them the elimination diet and then the reintroduction. One lady had never lost a pound, and they could put her in a hospital metabolic ward, they could starve her, nothing would go off her body. And when they found out it was carrots, and they took the carrots off of her, she lost 70 pounds in the next year. Anyhow, whatever you think you know, please be open to knowing that you don't know enough. So a food intolerance is a reaction that gradually develops without being obvious. There are some blood tests that can sometimes, or sometimes the only way is avoidance and challenge. So, sorry to make things hard. This is a book by a nice young doctor, Dr. Younger, and I was checking in the bookstore to see how my book, Detox with Oral Chelation, was doing, and here right next to my book was this nice book, Remove, Restore, Rejuvenate. I liked it. He's got some simple ideas. It goes into this field because nobody has enough answers yet. There's lots of opinions, but very little to back them up. Why is there nothing to back up all the opinions about detox? Well, because most of your patients aren't going to write a check out for $4,900 on the first visit and let you take the 20 tubes and send it to them outside of school of medicine. So the net result is everybody's flying blind. But if I feel better, that's pretty good. So I'm willing to go on that kind of medicine. That's subjective rather than objective with proof. But I have to have everybody be aware of the limitations of it. So he has a thing, a clean audit. What are the symptoms of toxicity? You have headaches more than occasionally. You get colds and viruses each year. You have diarrhea. Anyhow, this is a useful way. So I don't care how you get into it. I've got to get you into it. So there's no one pathway that leads to the whole thing. Buckwheat, in terms of getting rid of the gluten-free. The gluten-free is a major problem, and it's a lot more complicated than you know. Because it's not just gluten, and it's not just the food you thought it was. So I like this great article, Stopping the Wheezing and Asthma, Dr. Wright. What he's doing in this article was a talk that he just gave in December at the Academy for Anti-Aging Medicine. And this is a great talk because he's making you aware of what you never knew, because you don't read the literature from 1949. I haven't found any of you going to the library and getting every one of the science magazines from 49. But Jonathan Wright and Ellen Gaby have these articles. Ellen Gaby's new book, Nutritional Medicine, only cost you $300. But he locked himself in a room for almost 5 years. He's got 35,000 references. And you can sound like you really know what you're talking about. Spend $300 and you will be able to understand intractable asthma given 10 micrograms orally every day, wheezing disappeared in a week. The reason this is making me so mad, these talk by Dr. Wright, he pointed out how we have all been sold down the river by greed. Because all of this is unknown to any of you. And yet B12 alone, why is B12 unknown to any of you? Why did we actually take a doctor's license when he gave a patient B12 who didn't have pernicious anemia and she felt fantastic? She said, "Doctor, that's changed my life." And they said, "She didn't have PA. Without pernicious anemia, you can't give her B12. This is the level of incompetence we have in this sick world of ours. Methylmalonic acid testing is meaningful. If you join the Institute for Functional Medicine, Jeff Bland started all this, and you can know that you can't measure serum B12 and know anything, because if it's high in the blood, it may mean it's an unusable kind of B12. There's much more to know on everything. Whatever you think you know is not enough. And so you need to know that what's maddening is because we live in this greedy world. None of this gets taught. They're going to push a drug. And we have an epidemic of asthma, and no one is giving them B12. And in fact, if you did B12, you have to have a chance to fight with your medical board, unless you live in the enlightened state of Arizona, where we have a board of integrative and homeopathic medicine, or Nevada. Otherwise, if you're going to do good medicine, you need to take all of my lecture and really study what I've got here, because I'm giving all of these merely directions for you to go. Because obviously I've been doing this, practicing medicine for 53 plus years now. I can defend myself. And no medical board is a match for me because I can tear them apart. I can take the chart of any doctor from the head of any leading medical center and I can tear him apart. Because he's never asked the real questions. He's always treating the symptoms. So patent medicine is the crap that everybody is getting a prescription for because it's endorsed by our government and paid for with your tax dollars. Ridiculous. So the root of the problem, how are you going to get the intestine to have the right living organisms you need? And that is obviously difficult, because the food that we eat is always carrying these pesticides, insecticides, so it's hard for the good guys, and these good guys that have to be in our intestine are critical. So there's no single answer. There's no one correct answer, but you need to be aware of the major causes of dysbiosis: diets that are poor, imbalanced, lacking nutritional supplements, food allergies, repeated antibiotics. Look at these children that they treat with antibiotic after antibiotic, and they all wind up in autism. If you look at, I've treated over 2,000 children with autism. I have no problem with autism, but that's because I understand this. And I understand that that child needed not just the vitamin D the mother didn't get during the pregnancy, but we needed to do something about dealing with all of these heavy metals that are getting concentrated in all of us. And so when I deal with those children, there always is infection, and even though they are doing everything they can to destroy Dr. Wakefield, who pointed out that when he tested the children, and he did a colonoscopy exam, and he looked at the lesions in the children's gut because they were writhing on the floor with pain, and he took those lesions, he could culture out the identical virus that was in the MMR that was stuck in the child, the live virus. And nobody wants to believe that, because that's so frightening, that instead of looking into it, they do everything they can to vilify Dr. Andrew Wakefield, who should one day be knighted for willingness to stand up to the huge cartel behind vaccinations. So there's so much to know about what's really going on. Intestinal infection, you know, one of my friends is just a world-class expert at parasites. And he solves many problems for leading people in this world who are lucky enough, and he does it by EAV testing. He is really a top chef. He happens to be board certified in internal medicine. He's been the head of major Army hospitals. But he can practice the best of medicine, and no one can put him down because as the head of the hospital, they don't challenge him when he goes and decides which of the expensive drugs like Alenia, which might cost you $1,000, is needed for that patient's parasite. And in case you forgot your parasitology courses, a negative test for ova and parasite doesn't mean anything. Some of these parasites only move around when it's a full moon. So if you don't do repeated stool tests, you have no idea what you're talking about. So solving impossible problems requires people with extraordinary Sherlock Holmes tendencies. So everything to me in medicine is a Sherlock Holmes story. Candida self-check. The Candida, of course we have Candida. Anybody not having Candida, I mean, it's part of life, but it's when it's out of balance. Now this is really interesting. We have this epidemic now of GERD. And when you look at it, it is certainly not an excess amount of acid, folks. If you buy that simple little thing, the Heidelberg pH test, it only costs about $3,000. The capsule costs about $100. Take the capsule, it's a radio transmitter, swallow it, you put a little antenna on the stomach, put a belt on, and it's, once it reaches the stomach, it sends out its message, says, I'm down here in the stomach and I'm looking, but I can't find acid anywhere. This is the patient that's living on Tums and antacids and Rolaids, and is living on the purple pill Nexium and doesn't need it, because you are shortening the patient's life. 44% more fractures in patients who've been living on the proton pump inhibitors, because without acid you're not going to use the minerals you need. So let's go back and practice real medicine. Let's figure out what's really wrong. And it always starts with the need for fiber to sustain the healthy bacteria that we need, and then to get in the foods that you're not sensitive to. I'm sitting here talking to you as somebody who lived on betaine hydrochloride capsules, 6 and 8 capsules at a meal, same way Jonathan Wright treated many of his patients. I did all this testing on my patients, and I can tell you, I found 1 out of 100 that actually had excess levels of acid. 99 out of 100 didn't. So why would I keep doing the test? Only reason, my patients usually came from Mayo, Hopkins, world-class places, and my patients were sure that they must have too much acid, and they were telling me that I was nuts if I said, please take this betaine hydrochloride with your meals and all your problem will go away. So I would do the test merely to protect my reputation. That's an important part of tests. Patients can't believe if what you're saying is so different than what they've been told at the leading medical center. You have to spend their money and test. My average patient, I spent $5,000 doing testing, and that was 25 years ago. And that was generally 100% not covered by insurance, because since my practice is not usual, reasonable, or customary, and I wish not to be usual, reasonable, or customary, I wish to be an extraordinary physician, my tests are not covered by insurance, and patients had to pay cash. But that made them very interested in what the results were and highly compliant with the outcome. You see, since I got into this because of disabling heart disease with angina at the age of 29, unable to even walk up flight of steps, my patients initially were all patients who had heart disease, and they thought they were going to have the chest cut open. And so since I canceled bypass on everybody, and I let none of my patients have stents, and I don't let any of my patients go near those guys, because I point out to them I used to be in radiology, and all of what they're being told by angiograms is complete misleading nonsense. You need to understand a PET scan tells you what part of the heart needs blood, not an angiogram. It's all quackery, and they're killing people every day. I'm kind of pretty confident of that, because I cancel bypass on everybody in over 30 years now, and I don't get sued, so I might be doing something right. So I'm pretty confident, and this is the same story. What's really making you miserable and what to do about it. So anyhow, life goes on, but it's so difficult to practice this kind of medicine because it's outside of the system. You will be immediately identified as a deviant physician. That was the letter I got from Medicare, that my practice deviates. That was nice. You're speaking to a deviant physician, because I'm very devious. I actually want to find out what's really wrong. I don't want to just give you the latest and greatest stuff that the detail man. I don't need to see detail men, period. I don't need patent medicines. I need to treat causes. Health checkup. Who needs organic food? Our diet's killing us, and it's killing the planet. Keep the food flowing. Beef can be very, very healthy when it's really raised on grass. So can chickens that actually get a chance to scratch in the ground. It was wonderful for Time magazine to actually say that they looked at fruits, vegetables, beef, and in each case said it's worth your money to go organic. That's amazing. The world is changing. Our day is coming. So Dr. Ahima is right now the chairman of the Institute for Functional Medicine. He is the person that has taken Jeff Bland's thinking and brought it now to such a high level that they're now going to have departments that will be teaching in functional medicine in many of the medical schools across the country. So it's wonderful for you to know that he has got so much. If you just type in his name on Google, there will be about 50 hours of free lectures on every topic. And he's got this interesting story that has a lot of success in dealing with diabetes. And in talking about diabetes, it's really interesting for you to know that, you see the word? This is Dr. Ahima on PBS, and he's stating, I have 2,000 patients with diabetes who are cured. That is a word no one's supposed to use, cure. And yet he's telling you that that's the fact. And it's so astonishing that you can have PBS sending that out to a few million people, and yet doctors in mainstream medicine continue to say there's no cure for diabetes. So it's extremely interesting for you to know. And Dr. Ahima's approach is 7 Keys to Survival, which is virtually identical to my fight program. So we're really glad that we're all coming down. So all of us have some similarities in how we approach, but he has a plan, and the plan is there. And of course, once you get past diabetes, you're going to get into mental disease. You're going to get into obsessive, compulsive, and depressed, and senility, and dementia. And all of this is able to be treated. So we're going to take a break now, and the next topic we'll be encountering will be infections.